Passion Now Network for All, in short, CNN4All, Urbana, Illinois, USA.
Oh, in Bethel House of Refuge, Muhammad, Illinois, USA presents this week's breaking news in wellness in health for all people and all professionals. Good day. I am the Pete of Dr. Z and Pete, presently the president of Bethel House of Refuge in Muhammad, Illinois. Previous to that, I was the owner-operator of a commercial construction business operating in the East Central Illinois area. My wife, Stephanie, who works with the Electronic and Computer Engineering School at the University of Illinois, we live in Farmer City, Illinois. This is my distinguished co-host, Dr. Alex Rama Zechariah, MD. Doc is an MD. He's not just a regular doctor, and he's also a medical professor. And as I mentioned, he's the CEO of CNN4All International. Recently, Doc was the chief medical officer, the medical director of Presence, now Provena United Samaritan Medical Center in Danville, Illinois, in 2008 and part of 2009. Prior to that, he was the dean of one of the top 12 medical schools out of 300 plus medical schools in India, Christian Medical College in Ludhiana, India. Doc and his wife, Prema, also a retired physician and professor. Wouldn't you like to live in his house? They spent 43 years at Christian Medical College in Ludhiana, first as medical students and then as faculty until they retired in 2000. They now reside in Urbana, Illinois, where they've been since 2005. Doc, great resume, a lot of experience, a lot of knowledge. I hope you have a lot of input in this week's breaking news in wellness and health, and I need for you to explain to our viewers what we're all about here.
Please note, this is not medical advice. This is for your information only. Do not change your treatment based on this info. You may mention this to your physician, and you may even invite him.
Hey, invite him to look. Come on, tell him to join in and get his opinion on what he's hearing here. Listen, if you need to communicate with us, you can do that. We have a email address that you can write to us, ask questions, bring your point of view. Breaking news at CNN4All. That's breaking news at CNN4All. Okay. Well, welcome to this week's breaking news in wellness and health. In shortages, mid-level health workers as effective as physicians for certain services. This is the hypothesis. Countries facing severe shortages and poor distribution of health workers could benefit from training and deploying more mid-level health workers, such as midwives, nurses, right, medical assistants, PAs, any of that, and surgical clinicians. In countries where such health workers have been deployed, the clinical outcomes, Doc, for certain services were just as good. Now, don't let this affect you. Even better than when physicians perform them. That's what the study's telling us. What do you think about that?
Yes, this study is from Pakistan. Yeah, but still it's applicable to some extent here. It's published in Bulletin of the World Health Organization 2013. The findings debunk the myth that more extensive use of mid-level health workers might lead to services of poorer quality. Despite the limitations of the evidence, it seems that in some areas, watch out, some areas, they actually outperform physicians.
Well, you may think that this is kind of, but here's what I know. Doctors got a lot of stuff on their mind. Their minds are going out. They have this patient in front of them and two more down the road. And it's kind of like a superintendent on a huge building project. The doctor would be like the superintendent, and then these mid-level health workers are taking care of some of the, what would be considered for the doc, minutia, don't you think? And so rather than insulting the medical profession, what we're looking at is they're beginning to assess their own productivity, right?
Yes.
It's like fixing yourself, because everybody recognizes doc is in. Okay, you got this. Okay, we're out of here. And then you think, man, what kind of treatment is that? But when the mid-levels come in and they're checking you out and conversing, you remember we talked about it a couple of weeks ago.
Absolutely.
The bedside manner of the patient doctor, the doctor interacting with the patient has a lot to do with his recovery time.
And I tell you, though both the nurse practitioner and the
Yes.
physician assistant, more compassionate, more time, more empathizing.
Yes.
Not that the physicians don't have it, they don't have time.
Right.
Because they are sorting out what, if I mean, not to miss the primary diagnosis in the patient's best interest.
Right.
Yes. So
Right.
this is a very
Well,
good
and I
study.
think too, what it's going to do is up the acceptance
Absolutely.
in the general population.
Yes.
That you don't always have to see just the doctor to get proper medical treatment.
Yes, and U.S. with the Obamacare introduced the
Yeah.
physicians' task force shrinking. You need more of them.
Right. Okay. Well, you can tell. This is breaking news. Faced with the knowledge that between 82 and 90% of medical patients are unable to correctly name their treating physician, so that knowing who your doctor is and a couple of facts about that person may go a long way toward improving patient satisfaction. You know, that's talking about personal interaction, because you don't find that out.
According to a Vanderbilt study published in the Journal of Orthopedic Trauma 2013, patients were randomized to receive a card giving the info with the picture of their treating physician, and the patient satisfaction scores for the group receiving the card were 1/4 higher than those who did not receive the card.
Well, you know, that's true, because if you could associate
Yes.
with him and say, hey, this guy is somewhat like me,
Yes.
and have just a little bit of information, it improves everything. All right, check this out. Earlier onset of puberty in girls is linked to obesity. New research shows that obesity is the largest predictor of earlier onset puberty in girls specifically, which is affecting white girls much sooner than previously reported. The multi-institutional study strengthens a growing body of research documenting the earlier onset of puberty in girls of all races.
Of all races, yes, we have watched this. Published in Pediatrics, November 2013, the study shows that obesity is the largest predictor of earlier onset of puberty in girls, which is affecting white girls much sooner than previously reported. Body mass index was a stronger indicator of earlier puberty than race or ethnicity.
Isn't that funny? Well, it means like your body's on autopilot.
Yes.
And that body mass index size,
Yes.
when you get to a certain size, everything begins to kick in.
It switches it on.
Yeah, that really is good to know.
So
parents,
keep your weight healthy.
yes, and parents, watch your children.
Yes.
Turn off the TV when you're eating. Lower education levels linked to unhealthy diets. People with lower levels of education may eat larger amounts of unhealthy, calorically dense food than those with a higher education level, possibly because they're more physically active.
Very interesting.
Yeah, isn't that funny?
The new research
Exercise more.
published in November 2013, Journal Plus One from Germany shows that people with lower levels of education may eat larger amounts of unhealthy, calorically dense food, talking of blue-collar workers,
Yes.
than those with a higher education level, possibly because they are more physically active, possibly as blue-collar workers, leading to higher consumption of sugar and fat-rich foods.
That means the active people are eating more.
Yeah.
Okay,
Yeah,
now my
active
wife
people.
loves blueberries.
Yeah.
Health benefits of wild blueberries abound. New research shows that long-term wild blueberry diets may help prevent pathologies associated with the metabolic syndrome. You'll probably have to explain that, including
Diabetes,
Okay.
heart disease, hypertension.
oh yeah, cardiovascular disease, diabetes, and hypertension.
Study by researchers at the University of Maine, published in the journal Applied Physiology, Nutrition and Metabolism, November 2013, shows that regular long-term wild blueberries diet, go wild on it, may help improve or prevent pathologies associated with metabolic syndrome, including cardiovascular disease and diabetes.
Oh my goodness! So you know we're going to
Gout is another metabolic disease.
We're going to be beating the drum of proper diet and
Yes.
more exercise. Here we go. Aerobic exercises improves memory, brain function, and physical fitness. There's the hypothesis. A new study found that engaging in physical exercise regimen helps healthy aging adults improve their memory, brain health, and their physical fitness.
Published in the journal Frontiers in Aging Neuroscience, November 2013, the study found that engaging in physical exercise regimen helps healthy aging adults improve their memory, brain health, and physical fitness. This finding is significant considering that among adults 50 and older, staying mentally sharp outranks social security and physical health as the top priority and the concern in the United States.
Yeah, listen, when people are talking about their elderly parents or they're talking about themselves, well, I still have my mental faculties.
Yes.
And so that's really the deal. For obese teen girls, aerobic exercise may trump resistance training in health benefits. Aerobic.
Yeah. Yeah.
New findings suggest that for teen girls, aerobic exercise might be superior to resistance training for cutting health risks associated with obesity.
Very interesting.
Yeah.
According to the American Journal of Physiology, AJP, Endocrinology and Metabolism 2013, findings suggest that for teen girls, aerobic exercise might be superior to resistance exercise for cutting health risks associated with obesity. Also, girls in the aerobic exercise group seem to enjoy their workouts more than those in the resistance.
That's exactly right. You're doing this
Yes.
as opposed to this.
Right.
You bet. Also, it says we're discussing why women have greater shortness of breath than men do when they're exercising. Maybe it has to do with lung capacity. I don't know.
Yes, that's
the
right.
women find it harder to breathe than men during exercise due to a greater electrical activation of their breathing muscles. That's what this new study is demonstrating.
Same thing what you said. The study published in the journal Experimental Physiology, November 2013, findings indicated that greater electrical activation of the respiratory muscles during exercise in women, because they are working harder, is needed to compensate for their biologically smaller lungs, what you said, airways and breathing muscles. They have to work more.
I might be able to become a physician's assistant. Who knows? I'm working as that
You
here
are.
with Doc. Okay, schools help kids choose carrots over candy bars. Isn't that the truth? When schools adopt healthful nutrition policies and practices, kids' diets improve. Go figure. That's if you have carrots instead of candy. New research, when schools offered snacks in lunchtime a la carte or vending that were mostly or entirely healthy, students responded with improvements in their diets.
That's interesting.
Yes.
Published in the Journal of Childhood Obesity, November 2013, when schools offered snacks in lunchtime as an alternative, vending that were mostly or entirely helpful, students responded with improvements in their diet.
I seen that in my grandkids. One of them, her favorite treat is raw broccoli, and her little sister wants M&Ms.
He's watching this?
Yeah, I hope so. I hope so.
Breaking news?
Yeah. All right, now here we're going. We're going to another drumbeat. Tobacco myths persist 50 years after the U.S. Surgeon General warned Americans of smoking dangers. That's right. Tobacco misconceptions prevail in the U.S. despite the dramatic drop in smoking rates since the release of that first Surgeon General report on smoking and health in 1964. Now, here's what it is. Tobacco myth. Number one, almost no one smokes anymore. That's not true. Fact, about 43.8 million people still smoke. That's 20% of the population of the United States.
Yes. Myth number two, e-cigarettes, cigars, and hookahs are safe alternatives. Fact, all tobacco products, including e-cigarettes and hookahs, the middle,
bongs,
have nicotine, and its nicotine's highly addictive properties that makes these products harmful.
Yeah, it's nicotine. Okay. Myth number three, infrequent social smoking is harmless. Fact. This is fact. It's not fact. Any smoking, even social smoking, is dangerous to your health.
Myth number 4, smoking outside eliminates the dangers of secondhand smoke. Fact, there is no risk-free level of exposures to secondhand smoke. Even brief secondhand smoke exposure can cause harm.
Man, we really need to wake up with respect to all of these things.
Yes.
Listen, we'd like to thank you for watching, every one of you. We will be back very soon, and we do have, I thought I heard Dr. Ross back there. And he'll be joining us. He's our resident expert on many things. He'll be joining us in our panel discussion. We'll be right back.
My hero doesn't bat 500, doesn't have an exciting job, doesn't drive an expensive SUV. My hero stood by my mom when she was pregnant, worked hard to help us, chose to have and love me. My hero? My dad.
If you're facing an unplanned pregnancy, learn more today about parenting or adoption. While there are unwanted pregnancies, there are no unwanted children.
Compassion Now Network for All, in short, CNN4All, Urbana, Illinois, USA.
And Bethel House of Refuge, Muhammad, Illinois, USA. We're coming together for our panel discussion. This is my co-host, you know him, Dr. Alex Raymond Zechariah, distinguished medical professional, Doxon MD, and a medical professor. Also the CEO of CNN4All International. And we have our distinguished expert, Dr. Ross Yoha.
Thank you.
MD. And he's joining us, and we're going to jump right into our panel discussion. Today, our panel discussion is about colon cancer.
That's correct.
And early detection.
Early detection.
All right, check this out, Doc. In the U.S., over 100,000 new colon cancer patients every year.
That's huge.
Oh, it's astronomical. Second leading cause for cancer-related death in the U.S. We need you, Doc, to tell us, give us some sort of an idea of your thoughts on all of these things.
Colorectal cancer screening are the most important factor in early detection. Most people should begin having colonoscopy at the age 50 at intervals of 10 years. Okay, let me sing that song. Stool test for occult blood every year. 50 plus years for colon cancer screening. Sigmoidoscopy every year. Colonoscopy every 10 years.
All right, Doc, you've hit like 3 or 4 subjects that are kind of clouded in medical descriptive language. So I want to ask you a couple of things. What's a sigmoid, whatever you call it?
Sigmoidoscopy.
Yes.
Sigmoid is that part of the colon before rectum.
Okay.
Okay, so you have the right ascending colon, then right transverse colon, descending colon, then sigmoid colon, then rectum, then anus, right?
Okay.
So sigmoidoscopy is a very short instrument that you put, that's
like
correct,
that?
you got it. And you put in there, and that doesn't require any lengthy overnight preparation.
Okay, so like colonoscopy, they require you take all this stuff and your whole internal mechanism for digestion is cleaned out.
They make sure that your colon is free of any solid matter, so they make you fast, all clean it out like a tap, opening a tap.
Oh my goodness, yeah, and then you have to take this stuff so there's nothing in there. They get a clean
Nothing.
view. All right, so what about this sigmoid, whatever you call it?
Sigmoidoscopy doesn't need any preparation. You just go into the office and they put in there and see.
All right, so sigmoid is the sigmoid colon, and oscopy is the looking at it.
Scope.
Oh, okay, scope. So and it doesn't take very long?
No, very short.
All right, good. All right, what are the other things, Dr. Z? You're talking about what?
Stool tests, such as the fecal occult blood. Fecal occult blood. That means looking for traces of blood
in the feces.
That is occult, means it's hidden, and fecal. And fecal immunochemical test every year. That is Again, you take feces and look immunological test. And so fecal occult blood test is very cheap. It takes a couple of dollars, but the FIT costs money. But anyway, this is it.
All right, so Dr. Ross, how often would one consider taking these tests? I mean, that colonoscopy's got to cost an arm and a leg.
Yeah, sigmoidoscopy every 5 years, colonoscopy every 10 years.
All right, describe that colonoscopy for me.
Yeah, haven't you had one?
No.
Oh, no, you need to. Well, you need to prepare and you need to take, so you'll wash out your colon overnight. You will need to drink a cathartics. Cathartic means that it washes you out and then nothing is left. And so your colon is free. Then this very flexible instrument is introduced from your bottom. And you think it may be uncomfortable. No, they give a sedative and you may even go to sleep with it.
All right, so then what do they do? I mean, what do they do, like drive a pickup truck in there?
No, in colonoscopy, a tiny camera is used to examine the colon and rectum. If polyps are found, they can be removed during this procedure.
Well, is it painful?
Not at all. A slight discomfort that you are sedated. And, you know, when they did it on me, I went to sleep and I woke up. Hey, doc, when are you doing the sigmoidoscopy? And then colonoscopy. He said, it's done. I couldn't believe it.
Really? So, what do you think, Dr. Z, after that? What do you do?
You know what? I like to sing a song against stool test for occult blood every year. 50 plus year for colon cancer screening. Sigmoidoscopy every 5 years. Colonoscopy every 10 years.
Or you're not got an agent out here trying to get you signed to some record deal.
Yeah, absolutely.
Come on. yeah, you're making enough dough as a physician.
Yeah.
All right. Well, so they say when you, I want to know what we have like virtual, a lot of things,
Hey,
virtual
you got
food.
it.
What about virtual colonoscopy?
Yeah, you're smart. You know your stuff. Anyway, virtual is virtual. It's a colonoscopy. Uses a CT scan, just like the ultrasound.
Yeah.
Just CT scan to create a 3D model of your colon. You know, they thought in it, you had to drink a dye, so it shows the contrast and also reveals polyps or other problems.
Well, if you got polyps in a virtual scan, do they virtually take them out, or do they have to do the surgery?
That's a good one. You know, the problem with virtual is they just see it, they can't do anything about it.
Oh, so they now have to go in anyway, right?
Yeah, after that they'll do a colonoscopy and remove it. So why not colonoscopy in the first place? Because virtual colonoscopy costs a lot and you can't do very little about it. Yeah, screening is also allowing more colorectal cancers to be found earlier when the disease is earlier to cure. As a result, there are more than 1 million survivors of colorectal cancer in the United States.
That's pretty serious cancer, isn't it? It's nothing to mess with.
No. So early diagnosis. Occult blood test. Okay. Can I sing again? Yeah, got this. Stool test for occult blood every year. 50 plus years for colon cancer screening. Sigmoidoscopy every 5 years. Colonoscopy every 10 years.
Well, the good thing is, what I'm hearing here, Doc, in all of our panel discussions today, in the recent weeks, is early detection is critical if you want to have a longer life and you want to be cancer-free.
You got it. Can you go over that again? You don't want me to sing again, so please go.
Oh, yes, thank you very much. Early detection, that's the greatest weapon that we have against these type of cancers. We've been talking recently about women and men, but in the last couple of weeks we've been talking about prostate cancer and colorectal cancer, and our greatest
breast cancer screening.
Breast cancer screening. Oh. Those things are early detection. Proactive movement, paying attention to your own physical body, actually paying attention to changes in your body. You know, even those rectal changes, you should be able to detect those. Change in bowel or bladder habits, those things are serious and you need to pay attention. You can also treat yourself. More veggies?
Yeah. No, number one, you do a simple stool test looking for traces of blood in the stool.
Okay.
So what is number one?
Number one.
Stool test.
Stool test.
For traces of blood.
Blood, right.
We medical folks call occult blood.
Yes. And then you have...
Then your doctor put in a gloved finger.
Yes.
So number two, doctor puts in a...
Number three would be sigmoidoscopy.
Sigmoidoscopy, which is quick, can be done in the office, and you're in and out. The sigmoidoscope will be in and out, and you can be in and out.
All right, and then the final one is colonoscopy.
Colonoscopy, which of course, then if we have plenty of money to throw around, virtual colonoscopy.
Or Obamacare.
All
right, well, listen.
Colonoscopy.
Colonoscopy.
Get it done.
Treat yourself. That's our recommendation today. We would like to thank you for being with us. Thank you, Dr. Ross, for all your
Thank you. It's such a pleasure. You are such a wonderful anchor.
Thank you, sir. I appreciate
that. This is your show.
Yeah. Thank you. Hey, I'll be talking to your agent. We also want to thank WebMD for the information that we've discussed today. Also, the City of Urbana's UPTV production coordinator, Jason Liggett, the one, the only, our production intern, Caleb Serpentis. We want to also thank the UPTV station manager, Jake Schumacher, as well as our in-studio, Jacob Bernard, the 3-camera whiz kid. And we want to thank the Chorister Fellowship, Theravada, Kerala, India, for the music score and the Hallelujah ending.
Hallelujah.
Thanks again, Dr. Ross, for being with us. Dr. Rama, we appreciate you being here as well. And we thank you all for watching. So we'd like to see you next time, and we'll be back next week.
Soon and very soon, we are going to see the King. Hallelujah.